I think the most important presentation for us in both ASCO and EHA is the long-term data, the 5-year data follow-up of our pivotal Echelon-1 study, which investigated the combination of Adcetris plus AVD in naive, newly diagnosed patients with Hodgkin's lymphoma versus the standard of care of ABVD. And I think it's very important to highlight here that Hodgkin's lymphoma is among the most curable human malignancies, with cure rates exceeding 70% in the current era. But still, there is a proportion of patients who still continue to relapse or progress and suffer a lot from these lymphomas. So the new study, Echelon-1, which started several years ago, was able to report recently the 5-year results. And the results basically corroborate all the previous findings. But of course, the statistics remain very robust, and it shows durable and deep responses in patients who've been treated with the regimen that includes Adcetris in the front line. There is a 7 percentage point difference in the progression-free survival, which corresponds to 30% less risk of progression with this lymphoma at 5 years. Although we don't have at the moment any survival analysis, the number of events of survival analysis is still quite low, so we couldn't analyze that so far, but it looks like many more patients remain free of the lymphoma beyond the important milestone of 5 years with a combination of Adcetris plus AVD. And the other important element is that this improved survival free of lymphoma comes with very manageable toxicities. And so far, there is no signal to suggest that this new treatment may cause an increase in secondary malignancies or a negative impact on the fertility of these patients.